Today is Dr. George J Georgiou. He is has a Bachelor of Science from Oxford Brookes University in Oxford, England. Clinical Masters in Clinical Psychology from the University of Surrey in Guildford, England. He has a Ph.D. in Clinical Sexology from the Institute for Advanced Study of Human Sexuality, San Francisco. He has a Doctor of Science in Alternative Medicine from the International Open University of Alternative Medicine, and his main research interests at present are studying the use of natural compounds in the detoxification of heavy metals. Today we have a really special show, and that is Dr. George Georgiou is going to do a show today on Candida, so we're really excited about that. Bill, let me turn it over to you for the official introduction for Dr. Georgiou, and then I'll come back on the screen.
All right, very good. Thanks, Dr. Al. Dr. Georgiou, this is a real delight for me to welcome you to the show, and we've been acquainted, I think, since 2003 when you were certified in metabolic typing, and we've exchanged communications often throughout the years, but this is the first time we've had the opportunity of meeting face-to-face. So I'm really excited to see you here, and I really appreciate you coming on the show, and really looking forward to what you have to share with us today.
Well, thank you, Bill. Thank you, Al. It's a pleasure to be with you and share some knowledge regarding quite a complex topic with other naturopaths and clinical nutritionists who deal with this particular problem. Perhaps I should just mention a couple of things regarding how I managed to develop a Candida protocol, mainly because I had Candida myself, along with many other problems, including chronic fatigue syndrome, fibromyalgia, hypochlorhydria, leaky gut syndrome, Candida. It was a real complex of problems. So at the time, because I became incapacitated, I really needed to find a way of bringing back my health. And I started studying the books that had been written on Candida. Often I would fly to the other side of the world and see the authors and sit down with them to discuss treatment protocols, etc. But what I was finding was that even these authors that had published books on Candida, they had some missing links, because I would feel great when I was on the Candida diet and the various treatments, but after 2-3 months of completing, then I would see that the symptoms would start creeping back. So that's when I decided to get into natural medicine and start studying various topics, beginning with clinical nutrition, and then naturopathy, then herbal medicine, then homotoxicology, and various other topics. And it was only after 11 years of completing that cycle that I managed to put together a treatment protocol that actually works. And once the Candida is eradicated, we're talking about the pathological mycelial form of Candida, obviously, then it does not come back again, because I've been 25 years now Candida free.
Well, that's fantastic, Dr. Georgiou, and I think, I don't know that we mentioned in the beginning, but it's very important that you are the inventor of HMD, heavy metal detox, and we're all very interested to know and understand more about HMD and its use. But as our discussions went between yourself and myself, we thought it best to really deal with or address the issue of Candida, because really you can't deal with heavy metals effectively as long as Candida is present. So this is really a prelude to our discussions later on regarding HMD, but I wanted to be sure and have everyone know that you are the originator and the inventor of HMD.
Well, hopefully we'll have another program and we can talk about HMD, even though I work within a holistic model, and so therefore everything is interrelated in the same way as you guys, working with metabolic typing. So you cannot just take a patient and just deal with the Candida and leave everything else intact. And hopefully we'll be touching on a few of these holistic points as we go through the slideshow today.
Very good. All right, Dr. Georgiou, feel free to start the slideshow presentation whenever you'd like to.
Okay, I think we can get into the topic. There's a lot to cover today.
All right.
So as soon as you're ready, we can begin the slideshow.
Very good. Should be coming up now.
Yep, we're in there now. Perfect.
Okay, just starting with a few statistics from the World Health Organization, they postulate that about 1/5 of the world's population actually suffer or has suffered from various forms of candidiasis. It's the 4th most prevalent microorganism causing disease, and it comes first for causing hospital mortality from septic conditions in the US and Europe. So I start with these bleak statistics just to emphasize that this is a serious microorganism that we need to pay attention to. The most dangerous forms of candidiasis include pulmonary candidiasis, Candida meningitis, and Candida endocarditis, because they are killers. And obviously, when a person is immune compromised, then Candida can actually kill them because there is no immune system to keep it intact. If we look at the amount of patients that I'm seeing here in Cyprus, where I work at the Vinci Holistic Health Center, I probably estimate between 25 and 30% of my population are diagnosed with systemic candidiasis. Other practitioners in the Western world, bringing up statistics of up to 40%. If we go to the next slide, we can see two of the leading researchers, pioneers, because Candida, before Dr. Orion Truss wrote The Missing Diagnosis and Dr. William Crook wrote The Yeast Connection, not much was known about systemic candidiasis. And as they've written, few illnesses have sparked as much hostility between the medical community and the lay public as the chronic candidiasis syndrome. That was written many years ago, but it still applies today because it is a big issue, and many medical doctors do not recognize the diagnosis of systemic candidiasis. If we look at the next slide, we'll see an image of a normal fungus, Candida albicans, which is normally present in the GI tract. It is a unicellular organism that has a cell wall, a nucleus. This one is actually budding a daughter cell, so it reproduces asexually, and it sits in the gut dormant, mainly because of the friendly bacteria in the gut, the Acidophilus bifidobacteria, etc. It's only when we disturb those friendly bacteria that we begin seeing a pleomorphic change between this normal budding Candida to a mycelial form of Candida. There are about 81 different species of Candida. The most common ones are Candida albicans, Candida glabrata, cruzi, parapsilosis, tropicalis, etc. The next slide asks the question, do all people have it? Well, if we look at young babies in the research that has been done, we see that about 90% of 6-month-old babies test positive for the normal budding Candida. This is not the mycelial pathogenic form of Candida. This is the normal budding Candida, which does not produce symptoms. What is the role of the Candida? Well, in a nutshell, it is there to digest us when we die. Because when we die and the friendly bacteria in our gut also die with us, then the Candida, being a diploid organism that basically has one gene controlling two proteins, it will flip the switch from the normal budding Candida to a pathogenic mycelial Candida that starts producing phospholipase enzymes that drill into the gut, and they get into the tissues and they start digesting the tissues so that we go back to the soil. So this is the main role of the Candida. That's why the friendly bacteria in the gut is absolutely crucial to maintaining a symbiotic balance between the normal Candida and the pathogenic Candida. If we go to the next slide, we can see a magnified photo of the Candida. We can see that it has a cell wall, it has a plasma membrane, it has mitochondria, vacuoles, nucleus. It is like a normal cell. And maintaining those good bacteria is also a part of maintaining a good immune system as well. The next slide shows us what happens when an imbalance between the good bacteria and the bad happens. Here we can see that the unicellular normal Candida begin to change because the switch is flipped over as the amount of friendly bacteria begin to dwindle in the gut, and there are many factors that can do that. Then the switch is flicked, and then we start getting the production of the pathogenic mycelial form. And this can happen either because of antibiotic abuse. These are electron microphotos of the normal Candida on the left and the mycelial form on the right. The mycelial releases phospholipase, as I mentioned, which is an enzyme that attacks the cell membranes of the mucosa. It splits fatty acids, generating free radicals, and it causes a hell of a lot of inflammation in the intestine. The mycelial forms also release 79 different toxic byproducts that damage specific tissues and organs and will determine what symptoms will follow. These toxins, like the aldehyde group, for example, can also compete with hormone receptor sites and cause a whole variety of different endocrine problems, such as hypothyroidism, hypoestrogenism, binding cortisone, progesterone, and many other hormones. The next slide will show us the pseudohypha with the chlamydospores. These are the grape-like spores making up the clusters of the blastoconidia. And the next slide, is it a true epidemic? Candidiasis is the most underdiagnosed medical condition in the US, says Dr. Patrick Quillen, who was one of the researchers, and many other doctors agree with him. So in the next slide, we ask the question, what is the role of Candida? We mentioned one of the roles. That is, after we die, it decomposes the body, feeding, off the corpse, off the tissues, because they get broken down with the phospholipase enzymes that the mycelial form of Candida produces. And the second is that it gobbles up putrefied food matter in our digestive system, which mostly is caused by improper digestion due to low stomach acid. When we do have low stomach acid, it really does open a door for the mycelial form of Candida to take root. Okay, the next slide is asking the question, how do we get it? Probably the most common cause is an abuse of antibiotics, where the antibiotics do not only destroy the harmful bacteria, but they also destroy the good bacteria. And if that happens, then obviously we get a conversion from the normal Candida to the mycelial pathogenic Candida. Other drugs like hormones can do it, birth control pills and other hormones used for cases of sterility. Copper IUD coils are very good yeast promoters. Also excessive stress, elevated cortisol levels, chemotherapy, radiation, diets that are very high in sugar, refined products. There are many different factors that set the scene for the mycelial pathogenic Candida to take root. In the next slide, we ask the question, why is it a serious problem? Well, it's serious because the 79 different mycotoxins that are released by the mycelial pathogenic Candida can severely compromise the immune system, and that will lead to serious degenerative diseases all the way through to cancers. If we look at some of these mycotoxins, such as the acetaldehyde group, this is known to adversely affect red blood cell flexibility, making the cells abnormally rigid and thus impairing circulation and diminishing oxygen transport. They can also create mental symptoms because the acetaldehyde groups bind to the amino groups of various neurotransmitter substances in the brain. The acetaldehydes also interfere with acetyl coenzyme A function and the metabolism of glucose, which are both inherent components of energy production according to the Krebs cycle. It's also known to interfere with the absorption of vitamin B6, the metabolism of beta-carotene, magnesium, and various other proteins. The mycotoxins can also interfere with delta-6 desaturase enzyme pathways during the synthesis of prostaglandin hormones, and this will lead to inflammatory conditions and leaky gut problems. So you can see that I've just taken one example of a mycotoxin, the acetaldehyde, and given you some biochemical pathways of how this one of 79 different mycotoxins can cause havoc in the body.
Dr. Georgiou, that's very interesting about the acetylcoenzyme A. I hadn't heard that before, and it occurs to me that very possibly that might be one reason why there is a sugar craving in those who are suffering with candidiasis, because sugar craving is really the primary symptom or indicator of glucose metabolism dysfunction or cellular oxidative dysfunction, where the body is unable to produce sufficient energy in the cells. That often will produce the primary reaction of craving for sugar. So I think it's commonly thought that this sugar craving that people have is the Candida talking, if you will, or it's just, you know, the desire of the Candida itself, and there may be that component. But if Candida is directly disrupting carbohydrate metabolism and energy production from that, that likely is where the craving for sugar comes from.
Yeah, that's correct, Bill. It's correct. The yeast can also ferment carbohydrates. You know, it can actually produce alcohol
Right.
in the body. Yeah, the point is that it really does reduce the ATP production through various metabolic pathways.
Very interesting.
So the next slide is asking how yeast toxins actually injure the immune system. On the left-hand diagram, we can see that the yeast and the intestinal lactobacilli in the gut are in balance, and here we have a normal functioning immune system. We can see that the helper cells, which stimulate the B cells to make antibodies, and the suppressor cells appropriately oppose the B cell antibody production. So antibody production is in balance. However, if we look at the second diagram on the right-hand side, we can see that an overgrowth of the intestinal yeast in the gut released toxins, those little black dots, into the bloodstream, and this will alter the immune function, because these toxins will inhibit the suppressor cell functioning. So we get a far greater antibody production by the helper cells. The helper cells are now unopposed, and the inappropriate antibody production occurs. So here, this could lead to a heightened state of allergy, as well as an increased susceptibility to autoimmune conditions. In the next slide, we can see what happens when other health conditions become involved, and this is known as the Candida-related complex, CRC. And these can include chronic fatigue syndrome, the APICHS, leaky gut syndrome, fibromyalgia, multiple chemical sensitivity syndrome, MS, hypothyroidism, endocrine disorders, emotionally related disorders, and a whole variety of different gynecological problems in women. A lot of people ask the question, is it really dangerous? Well, as you can see from this graph, there's an increasing number of life-threatening Candida infections that are reported over the last decade or so. It is probably because of many other factors, such as toxicity factors, imbalancing diet, nutritional deficiencies. I mean, let's face it, we are bombarded with a whole variety of different toxins, whether they're heavy metals or xenoestrogens from plastics, PCBs, bisphenol A's. All of these are just adding links to the chain that will eventually lead to a compromised immune system, and then, you know, Candida comes along and really wipes it out. In the next slide, we can see some examples of some of my patients that I've seen over the years. We've probably treated in excess of 3,000 patients in the last decade successfully. This is a patient, a young lad that I saw with Candida on the tongue, and the mouth corners have angular cheilitis. He had an underlying immune deficiency problem, and you can see the pseudo membrane composed of cells and pseudohyphae of Candida albicans. If you look at the next slide, this is 6 weeks on. The Candida protocol is 3 months, so this is halfway through treatment. You can see that there is a big difference, and also in the symptomatology of the patient. The next patient had psoriasis, quite a bad case, and this is before the Candida treatment, and the next slide will show after the Candida treatment, after she had completed the 3 months. The next slide shows Candida of the rectum. This can also cause rectal fissures, and it's a very painful condition that can be caused by Candida. The next is Candida of the vulva, which is a common condition in women. Candida of the cervix is the next slide. This is also very common. Candida on the penis is also fairly common. The next slide. A lot of these cases do not just have a topical Candida on the genitalia. They also have systemic candidiasis. Often they will go to medical doctors, gynecologists, etc., who give them topical creams or sometimes even antifungals. This morning alone, I had a young girl who's studying in the UK, came in, which I think she's got resistant candidiasis because she's had 30 courses of antifungal drugs. And I've seen a number of cases where that can actually cause a candida resistance. And even the protocol that I use is not enough in the 3 months to clear these resistant cases of candidiasis. Sometimes it will require 4 and 5 months of treatment. This is Candida of Nail, often seen in cases of systemic candidiasis. The next slide shows Candida in infants. A lot of infants are actually born with candidiasis, particularly if the mother has it. The next slide is Candida on the neck. This is one of my patients that went and saw in excess of 10 dermatologists, couldn't figure out what was going on. This actually cleared completely, but she had to leave the country before I had a chance of taking another photograph. The next photo is what can happen with systemic candidiasis in an immune-compromised person. This is actually a young child. I think he was 5 years old when he came to see me. He was diagnosed in an Israeli clinic with having Olmsted syndrome. Olmsted syndrome is probably the equivalent of AIDS. It's an immune compromised syndrome. The next slide shows just how Candida can literally start degenerating the mucosa and the tissues. This is the same young child with the Olmsted syndrome. The next slide was another very difficult case that saw many different dermatologists, couldn't figure out. This was quite a complex case because if we look at the next slide, this is before treatment. After treatment, he still had some specks, even though a lot of it had cleared, and we diagnosed that there was a bacterial pathogen involved as well. So as soon as we treated the bacterial pathogen, those spots disappeared. What are the signs and symptoms? Says the next slide. It's mainly affecting 3 systems of the body: the gastrointestinal, genitourinary tracts. This can cause a whole bunch of symptoms, including indigestion, bloating, food intolerances, gastritis, colitis, bloating, chronic heartburn, flatulence, gas, etc. The second is systemic. Here we have symptoms such as fatigue and lethargy, weight loss, weight gain, chronic fatigue, joint pain, stiffness, cold hands, feet, sensitivity to alcohol, sleep disturbances. And thirdly, the third category is the mental emotional manifestations that commonly reported: brain fog, irritability, inability to concentrate, feeling spacey, mood swings, anxiety, depression, etc. Now, the next slide could be reproduced, probably 50 more slides, because it's asking the question, what are the symptoms? We can write volumes on the symptoms. It can affect any part of the body because the mycelial form of Candida can penetrate any mucosa in the body, causing nasal congestion, discharge, all the way down the throat. Just imagine following the body's mucosa from the mouth down into the intestine, all the way through to the anus, plus all the other organs around those. I mean, it can affect and cause all of these symptoms and more on the next slide, and more on the next slide. So the next slide asks, what are the other problems of Candida? the yeast colonies can actually dig very deep into the intestinal walls, damaging the bowel wall and colonizing. So this will open up the doors for leaky gut, increased food intolerances, a greater immune response from the body. The toxins, the mycotoxins that we talked about previously, can inhibit suppressor cell functioning, and so stimulate antibodies by the helper cells to open up the door for a greater susceptibility to autoimmune conditions and other allergies. In the next slide, we can see the mycelial pathogenic form, which is from a skin scraping. You can see the clusters of the budding yeast cells and the branching pseudohypha. In the next image, we can see Candida in the vaginal wall, and we can see just how these mycelial strands can actually penetrate very deep into the vaginal wall. And treating this topically is at best going to push it back, but it will just keep on recurring every couple of months or so if you're not dealing with the systemic candidiasis. The next slide is showing Candida in the stomach. Yes, even though we have hydrochloric acid in the stomach, probably running at a pH of 3, the Candida can still penetrate into the stomach lining. You can see the hyphae fully penetrating the tissues here. Of course, when you have achlorhydria or hypochlorhydria, where the hydrochloric acid really does decrease, and I find this in probably 80% of the patients that I test with systemic candidiasis, then this penetration of the Candida into the mucosa of the stomach gets even worse, and they develop gastritis and other related symptoms. And then, of course, Helicobacter pops in as well, causing more havoc. And the next picture is an image of candidiasis of the kidney taken from a urine smear, and you can see the mycelia again with the blastoconidia budding from the pseudohypha. The question, are there differences, are there gender differences? Yes, there are gender differences. Women are 8 times more likely to get candidiasis than men, and we can see some statistics here: 60% women, 20% men, and 20% children. Why is this the case? Well, because of the hormone progesterone, which increases the amount of glycogen, which is easily converted into glucose in the blood, and that will feed the Candida. It's an excellent, ideal growth medium for the Candida. And of course, progesterone does increase during pregnancy, and if the woman before getting pregnant has systemic candidiasis, it's likely to get worse during pregnancy because of the high progesterone levels. The next slide is asking the question, how do you know you've got it? This is a difficult question to answer. Dr. Crook helped us by developing a Candida questionnaire, which basically describes all the symptoms of Candida, and the patient can fill this in. It's in 3 sections, and then they have a total a score at the end. I find this quite an accurate questionnaire, and so this is probably a good starting point. Personally, I use bioresonance testing using Vega technology and other Russian technology from a company called Deta Ellis. I feel that a lot of naturopaths and clinical nutritionists are lacking this diagnostic testing using bioresonance equipment, and hopefully we can have an opportunity with Bill to discuss this in another program, so that I can introduce you to bioresonance testing, which opens up huge doors in terms of being able to accurately diagnose not only Candida but many other microorganisms and organ functions and adaptation reserves of the body, and remedy testing, and so on and so forth. You can also use autonomic response testing that was developed by Dr. Klinhart, a neurologist working in America and Germany. It's a form of kinesiology. And then there are a variety of different antigen tests, the Candida-specific intestinal secretory and antibodies responsible for defending against yeast attaching to intestinal cell walls. But unfortunately, these are not very accurate tests because they do bring up a lot of false negatives. The Candida antigen titer test, the Candida antibodies and immune complexes, these are all tests, but they're not very accurate, unfortunately. The most accurate test is to listen to the patient, take a detailed history of the symptoms, use Dr. Croc's Candida questionnaire, and if you're au fait with the bioresonance testing or the kinesiology or autonomic response testing, then you can use this, and usually you get a very accurate picture just by doing this. Okay, let me just take a sip of water because we go into an important section here, which is treatment. This is the Candida treatment protocol. Sometimes it's referred to as the Da Vinci Candida treatment protocol, something that I developed and treated myself of the Candida. I've had it published in a number of peer-reviewed journals. The next slide shows an article that was published in Explore, the magazine for biological medicine. This was back in November 2005, volume 14. I've also published in the British Naturopathic journal. Okay, let's look at the treatments, and this is very important. I haven't actually changed the protocol probably for in excess of a decade, mainly because it works so well that I'm afraid to really start experimenting, particularly when you're experimenting with human lives that have really suffered. A lot of these patients do suffer, and they spend years and years trying to eradicate their Candida. The first objective of treatment is to starve the Candida, and you have to eliminate the foods that feed it. Now, there's a lot of controversy regarding what these foods are, but let me start with fruit because that is a controversial one. I have found that in the initial stages that if you keep fruit in the diet, which is rich in fructose, there is no way that you will be able to eradicate the Candida. So fresh fruit is to be avoided for 6 weeks. The initial 6 weeks you avoid the fruit, and dried fruits are avoided for the full 3 months of the treatment protocol. Obviously sugar and all the foods that contain sugar, whether it's white or brown sugar, honeys, syrups, liquors, lactose, fructose, confectionery, sweets, cakes, chocolates, ice creams, fizzy beverages, fruit drinks, biscuits, etc. Mushrooms, and this involves the therapeutic mushrooms, shiitake, maitake, etc. Refined foods, anything that's white flours, white rice, white pasta, heroin, cocaine, they're all white. Custards, white cereal products, all these should be avoided. Fermented products, anything that is fermented with yeast, such as vinegar products, alcohol products, pickles, mayonnaises, and nuts are okay, but not the nuts that have been sitting on the shelf without their shells, because they will attract fungal spores, and then you're introducing more fungi into the body. So if you want to crack your nuts, you buy them in the shell and you crack them and they're okay. You also avoid the rancidity of the lipid peroxidation that you get with nuts that have been sitting on shelves for long periods of time. In the next slide, we come to the second objective, which is to kill the Candida through the use of natural products. Now, we'll discuss these natural products in a minute because that comes up in another slide. The next slide is the third objective, which is to repopulate the bowel flora with high potency probiotics. The one I use, and I've tried many that are on the market, some have had university research, but the one that I've found to really have a physiological effect is one called Custom Probiotics. It's an American company. That's all they do. They just produce probiotics. And each capsule contains 50 billion live bacteria per capsule. They actually contain a lot more, but they say the 50 billion because obviously the bacteria do die off in the capsule, and the 50 billion that they're quoting here is 1 year after manufacture. Then the fourth objective is to regulate the dysbiosis and convert the pathological mycelial forms of Candida back to the normal forms. Now, this is what took me 11 years to discover. Not many naturopaths actually study live blood analysis and Professor Enderlein's work and the pleomorphic forms, which led to his discovery of the Sanum remedies, which are isopathic remedies. And these are what are used in the Candida Protocol for converting the mycelial pathological forms back to the normal form. Because if you don't do this, then after 3 months, it is highly likely that you will have 3%, 5%, 6% of the mycelial forms still present in the body. Once the patient starts eating normally again, they will feed these pathological mycelial forms, and then of course within a few months these proliferate, and they proliferate at an exponential rate when you feed them. To give you an example, one cell of Candida within 24 hours becomes 100 cells. Within another 24 hours becomes 100 times 100. Within another 24 hours, 100 times 100 times 100. And it's an exponential growth. So you can see how quickly these pathological mycelial forms can come back if you do not convert them to their normal pleomorphic forms using the isopathic Sanum remedies. So this is a crucial key that is not implemented by many practitioners around the world. And lastly, we need to restore a biochemical balance to the body. We need to strengthen the immune system, which again will help the immune system to attack the Candida. Of course, we follow the metabolic type diet, and within a holistic model, as the next slide shows, we can also help to restore the biochemistry of the body by going through naturopathic detox protocols or clinical nutrition detox protocols. I give them a 2-week detox with fruit and vegetables. A lot of people say, well, you know, fruit is feeding the Candida. Yes, but we are not treating the Candida during this phase. We are simply bringing the pH of the body back to its normal form. We are helping to offload some of the inflammation, the chronic inflammation. We are helping to clear some of the toxins. I also check them for food intolerances, because this is adding more inflammatory chemicals into the body. Go through a liver and a gallbladder cleanse. They go through a parasite cleanse. We look at their digestive system, and as I mentioned previously, approximately 80% have digestive issues, either with hypochlorhydria or deficiency in pancreatic enzymes. If they're constipated, we've got to fix that. That's a critical one. We can test them using the Barnes temperature tests for hypothyroidism or subclinical hypothyroidism. We can run a tissue hair mineral analysis to see what nutritional deficiencies they have and what load of heavy metals they have circulating in the blood. Remember that the hair mineral analysis does not show what is stored in the tissues. We can use a product that I invented, the HMD, for the heavy metals, because the Candida do tend to store heavy metals. So when you start killing them, they start releasing heavy metals, and it's good to mop these up. And we can use a whole variety of different drainage remedies. I've invented a herbal one called lavage, which in French means drainage, but you can also use homotoxicology or whatever you're familiar with. You can use the lymphomyosot, the berberis, the nux vomica, and so on and so forth. So if we are going to look at the anti-candida diet, which is actually crucial, this is the summary. I've already been through it, so just to emphasize the fact that fruit is a critical one, and you have to keep fresh fruit out of the diet for the first 6 weeks while you're killing and offloading the candida. And then I usually introduce 2 pieces of fruit, but solid fruits, not juicy fruits, not the citrus family, mangoes, pineapples, melons, watermelons, grapes, etc., because the sugar will enter the bloodstream very quickly with these. It's got to be a more solid fruit like apples, pears, plums, peaches, etc. And I ask them to have a fruit sometime in the morning and a fruit sometime in the afternoon. They can combine that with some freshly shelled nuts, just to keep in line with the metabolic typing. And the Candida-Killing Remedies in the next slide. The Candidaplex is a remedy that I've been using for a number of years. It's from VRP. It's an American company, and it contains undisilenic acid from calcium undiselenate. It contains resveratrol. The undisilenic acid will help to balance colonization of the candida. It also contains other ingredients like powder arco, a herb, which is quite a powerful antifungal, berberin, which helps heal the gut and it's very anti-inflammatory, and a vegetarian enzyme blend, which is specifically formulated to balance the growth of the Candida albicans. The second herb, Horopito, is a New Zealand herb, Pseudowintera colorata. There's a lot of university research to show that this is equally as powerful as antifungal drugs, but of course without the side effects. Caprylic acid, which is a coconut derivative, stops the reproduction of Candida. I use a Candida homeopathic at a potency of 30C. This I derived after many bioresonance testing experiments. And the custom probiotics, which is the 50 billion per capsule, I give them 3 of those, so they're getting 150 billion live bacteria injected back into the gut. I also combine it with a multivitamin, omega-3s, and of course the Sanum isopathic remedies. In the next slide we can actually see how the Sanum remedies are given. You're only giving these 6 remedies. The bottom one, the albican suppositories, is given normally to women who have vaginal candidiasis. and they can use that at the same time as they're using the capsule albicansan for converting the pathological mycelial candida back to the normal. The protocol is in much more detail in the articles that I've written, but if anybody is interested in even further details, they can communicate with me, and I will be pleased to share. We'll see that sometimes the patient can go through a Hertzheimer reaction. This could involve various aches and pains, bloating, dizziness, nausea, overall sort of flu-type feelings. But in my clinical experience, I find that the helter-skelter ride is the first 6 weeks, where these symptoms can appear transitorily, lasting no longer than 12 hours. It's always good, of course, for the patient to be drinking lots of water. The next slide talks about failed treatments. Why do treatments fail? Because there are so many practitioners implementing anti-candidal programs around the world. I've seen many patients that have done not only 1 but 2 and 3 and 4 different protocols, and yet they still have systemic candidiasis. One of the reasons is because you're using the incorrect antifungal therapies, and one of the missing keys, as I've just previously mentioned, is the SANM remedies, the isopathic remedies that convert the pathological mycelial forms back to the normal forms. If you don't do that, then the chances of killing off all the pathological mycelial forms within a 3-month period is pretty slim. And so therefore, even 1% with the exponential growth curve and the patient eating normally again after the 3-month treatment or 4-month treatment, they're going to be feeding the mycelial form. So from the beginning, we actually implement this from the 2nd week onwards. We add the SANM remedies. So we have a 10 weeks to the end of therapy to actually do the conversions back to the normal pleomorphic form. We have to check the levels of hydrochloric acid, pancreatic enzymes, thyroid dysfunction, colon dysfunction, constipation, maybe severe dysbiosis, parasites, patients eating inadvertently, and so on and so forth. So we really need to check all these things within a holistic model, because if we omit any of these factors and a lot more, then the patient is not going to get well just by moving in and dealing with the candida in isolation. The next slide, and we're coming to the end now. Do you have candida? Well, these are some of the symptoms: crave sweets, feel sick all over, have taken many antibiotics, have seen many physicians, have not found help, developing food allergies, and many more symptoms that are all present on Dr. Crook's Candida questionnaire. Is there hope? Next slide. Well, as far as I'm concerned, I can bet my clinic that if a patient comes to me with systemic candidiasis and they cooperate and are compliant with the protocol that I've shared with you today, then yes, they will recover fully, and their symptoms will melt away like ice melts under the sun. So yes, I can categorically state that there is hope. Thank you for listening.
Well, Dr. Georgiou, this was phenomenal. Thank you so much for this. I have a question regarding the therapy itself. Presumably, you are starving the Candida, killing the Candida, repopulating, doing all of these different elements simultaneously, are you not? Or do you have a specific sequence that is very precise in terms of when things are introduced?
Yeah, it's a good question, Bill. Basically, the whole process takes 3.5 months. I spend the first 2 weeks detoxing the client. I use the fruit and vegetables with the vegetable soups, stir-fry vegetables. They can take fruit during this period, because we're not treating the Candida, we're bringing back the internal milieu, the pH, flushing out toxins, and so on and so forth. When the 2 weeks, during that 2 weeks, I also do liver gallbladder flushes, I do parasite cleanses, I will give supplements, they can do their metabolic typing, they can do their tissue hair mineral analysis, etc., etc. Plus, I use other testing protocols as well. I use, bioresonance testing and what have you, and ask whatever questions I like. Once they've completed this 2 weeks of, let's say, cleansing and preparing the internal milieu, then we start the Candida Protocol. That runs for 3 months, and there they're keeping off fruit. They're keeping to the Anti-Candida Diet. They're taking their Horopito Candidaplex, caprylic acid, and the acidophilus. They're 2 weeks after that we introduce the Sanum remedies, and they run that for 3 months. So within a 3.5 month period, including the detox and the balancing of the internal milieu, they have completed the Candida Protocol, and we do everything concomitantly.
Very good. All right.
I have a question also, if I could jump in here 1 second, Dr. Georgiou.
Sure.
Do you find that people don't recognize the priority of Candida in a lot of cases where you see clients from failures of other practitioners? Are they going after things like parasites or other things that they're thinking is really where the problem is, but yet those things are secondary to a missed Candida?
Yes, I see a hodgepodge of different patients, because when the patient comes, they present symptoms, and then it's up to us as practitioners to go into the labyrinth and find out, what is causing these symptoms. A lot of the times upon testing, I do find Candida. Sometimes I don't even think of the Candida when the patient presents with the symptoms, because there's so many symptoms that Candida can create in a patient that it's very difficult to know whether the Candida is causing the symptoms, or whether the parasites are causing the symptoms, or whether other pathogens are causing the symptoms, or whether subluxations are causing the symptoms, or whether the wrong diet is causing symptoms. That's why you have to work within a holistic model. When you work within a holistic model, I mean, if someone comes to me and they've got a sore throat, and I do an iris analysis and find that they've got a subluxation in the cervical area, I will send them to a chiropractor or an osteopath to get that adjusted, because structure is also a very important aspect of health. So I try to work as holistically as possible, and often you find a patient that comes in with a simple, in inverted commas, symptom. They could come in with a migraine, but behind that migraine you'll find 20 potential causative factors.
Right, Dr. Georgiou, I think that's so well said, and it really aligns with our entire philosophy in metabolic typing. And I think that the point that should be emphasized to all of our practitioners is to realize through your explanation that Candida is itself really not the problem. It is a symptom, because candidiasis will not manifest in a healthy body, in a chemistry that's balanced, in a chemistry that is not carrying an excess toxic load of heavy metals or petrochemicals or what have you. All of the different stressors and blocking factors that we've identified in metabolic typing that can become primary causal factors of degeneration are the same ones that can result eventually in a candidiasis infection. So even though we have to absolutely treat the candidiasis, at the same time we must recognize that it itself is a symptom. Once it's present, then of course it becomes a cause of further conditions or disease syndromes. But if a patient has candidiasis, candidiasis is not the problem, it is a symptom of the deeper underlying problems, imbalances in the biochemistry, imbalances and inefficiencies in the immune system and the fundamental homeostatic controls, the presence of one or a number of stressors and blocking factors, all of which fall under our holistic model of metabolic typing that we must address. So I'm afraid that so many of us get lost or make that slip in thinking too allopathically that, oh, Candida is the problem, all I need to do is treat the candidiasis. That's not the case.
Yeah, and a lot of practitioners, they get into a variety of different tests, pretty much like allopathic doctors, and they stick their nose in the tests, but they're not actually looking at the patient in a holistic manner. In other words, they're seeing the tree, but they're not seeing the forest.
Beautifully said.
We need to look out into the forest to understand all the potential causative factors and offload them, whether we're looking at a symptom of candidiasis or a symptom of cancer, because cancer is also a symptom of a systemic metabolic disease. And if we can balance the body and remove a lot of these causative factors, then the body has the innate healing potential to begin healing with a little bit of help from the various remedies that we use.
Well, I'm sitting here with a big smile on my face because you just expressed our metabolic typing philosophy so perfectly. So,
but that's why I resonate with it, Bill. That's why I resonate with it. And hopefully we'll have an opportunity in another video to go through bioresonance testing, because I really do want to introduce this to the naturopaths and to the clinical nutritionists that you deal with, because it really does open a huge door and gives them tools to really, can you imagine, patient comes in and you want to identify exactly what parasites they have, exactly what bacteria they have, exactly what viruses, what candida loads and other fungal loads they have, what organ weaknesses they have, etc. This can all be done using bioresonance testing.
That's a beautiful tease for a future presentation, and I definitely want to invite you formally to come back to Metabolic Typing Live in the very near future and provide us that introduction. Absolutely.
Okay.
Thank you so much for today. Dr. Al, back to you.
Absolutely. Dr. George, before we leave, can you tell people the best way to get in touch with you if they want to contact you, and then I'll close out the show?
Probably email Al is the best way. If they just email me at admin@docgeorge.com, admin@docgeorge.com, then I normally respond to the 100-odd emails that I get every day.